Good afternoon, everybody, and welcome to the Community Diagnostic Centre International Recruitment webinar. I am hoping that all of you are going to be able to look at what we have to say, please use the Q&A box to put in your questions. We will try to answer as many questions as possible, and the rest we will be putting up as FAQs as well. I'd like to just introduce the team who's with me. So I'm Geeta Menon, and I'm Postgraduate Dean for South London and the Lead Dean for Cancer and Diagnostics. I have with me Neris Blake, who is the Deputy Diagnostic Workforce Lead, and Simone Tovey, who is the Deputy Lead for the Community Diagnostic Centres and is leading on the accelerated CDC program. I'm going to now hand over to Simone, who will give us an update on what the CDC program is.
Thank you very much, Geeta. Great to be here. So just to set out a little bit of what you probably already know, but to set the scene and give the context of what we're doing and why we're doing it. So the CDC programme, as you all know, set out to deliver increased capacity in the form of developing community diagnostic centres that provide accessible care to the population on a site that does enable pathways that deliver a coordinated set of tests in one visit to minimise the number of visits that a patient needs to do, but also delivering a faster diagnosis pathway that helps to improve outcomes. So we've made significant progress thanks to systems, regions and trusts in delivering 105 permanent sites that are now live. In addition to that, we have 153 sites that are approved, of which the majority of those will go live in 2023. However, some are in 2024. There is a forecast of delivery for 23-24 of 4 million tests, with up to 170 sites that we believe will be operational by March 2025. In addition, there is an aim to deliver up to 9 million tests by the end of the programme in March 24-25. As part of that, we acknowledged and we know that workforce is integral to enabling both the operations and also the delivery of activity. We were asked by the ministers to accelerate our plans and deliver that activity sooner. We did some modelling in relation to the workforce requirements that would be needed to support that, and we predicted approximately about 400 workforce professionals that would be required to support this aim across those that are delivering and enabling that activity in community diagnostic centres. So following that request, we then set out a number of actions that we have taken as a CDC programme, one of which has been enabling agency to support in the interim for these sites to go live. But we know that is not sustainable nor affordable, and even with agencies, there's not sufficient. Therefore, we need to look at how can we feasibly, for the longer term, support that supply. We have, from the 23-24 revenue, supported training posts for those CDC sites and some levels of practice educators as well. But in addition to that, we know that the training, and we have heard from you all, how long that training can potentially take. Therefore, in the short to medium term, we wanted to take an action, of which the international recruitment is what we are taking forward, and that has been supported and signed off. So as part of that, what we wanted to do was make sure that we gave a comprehensive package to support trusts in delivering this. And that incorporated the spread of the professionals that will be delivering the services within the CDCs, where it is feasible from an international recruitment perspective. We also wanted to make sure that there was support to delivery of, we know that to do this quickly, we need staff, we need HR, we need admin. And we also wanted to make sure that was practice educator support from a pastoral care perspective, but also to support bringing these candidates into the CDC sites and across the trusts. Experience is absolutely key, and the principles of what we're trying to drive here has that at the heart of everything we do, both for staff and for patients. And as such, the pastoral care element is something that we strongly advocate for. So many of you have come forward with the intention of what you wish to have in relation to international recruits. And what we want to do today is to answer any questions that you may have in relation to the programme, and as Geeta has said, follow up with any frequently asked questions afterwards in a paper. So thank you very much. Handing back over to Neris.
Good afternoon, everybody. I'm Neris Blake. I'm the Deputy Director for Diagnostics Workforce. Thank you for joining this webinar. Obviously, we're here today to discuss the International Recruitment Programme to support the CDC acceleration. But I just wanted to assure you, I think before we get into the detail of that coming up, that the International Recruitment Programme is part of wider workforce plans to support the growth and transformation of the diagnostics workforce. So the approach that we have in a more general sense around supporting the workforce utilises the triple aims of the People Plan, which is around more people working differently in a compassionate and inclusive culture, and utilising all of those workforce levers and utilising the most impactful levers at the right level as well. So, for example, we know that it's really important, alongside some of the short-term injection that international recruitment can bring, it's really important that we continue to grow our workforce in the medium and longer term through some of the formal education and training programmes, but also that we're sort of growing our own workforce, for example, through a whole range of apprenticeships, through upskilling, and through new roles as well. So this just gives you a flavour of those workforce levers, and I'm happy to share some more information around some of the aspects that we're taking forward alongside that. Thank you. I will hand back to Geeta now.
Thanks, Neris. So I'm now going to talk to you about the plans for international recruitment. So like Neris said, this is a part of the bigger picture, so don't take this as a silo approach. So nationally led international recruitment program that we are trying to do is to deliver the workforce to meet that additional need that is generated through the accelerated CDC program. The CDCs require the skilled staff, and which includes where recruitment from the UK may only prove challenging. So we are looking at the training numbers that are there in these different professions in the UK first, and then deciding what needs to be put under the international recruitment banner. We are planning to recruit approximately 400 skilled workforce, and the program will recruit from overseas, working with specialized international partners, with the CDCs, the host trust, and NHS England. Currently, we'll be working with two of the organizations, Apollo Hospitals and BTA, and we've made sure that the recruitment for these international professionals will not be taking place in any of the countries which are identified by NHS employers as either red or amber. What this program is international safe recruitment, I call it. So the supply pipeline is going to be for imaging, it will be radiologists and radiographers. For pathology, it's histopathologists. Physiological sciences, we have echocardiographers and respiratory physiologists. And then we also have dermatologists, audiologists, and gastroenterologists. So the demand planning was first initiated. So we looked at a demand-based model on the workforce projections for the accelerated program for the 25 CDCs that Simone just mentioned. And there was a detailed scoping exercise that was done to look at and identify which is a specific workforce requirement that is needed for the different CDCs. And the idea was that this, from the revenue, it would require a 2-year confirmation of salary. And for some professions, the employing organization will need to commit to 3 years. CDCs will receive further funding, like Simone mentioned, for covering the relocation and onboarding costs. The Workforce Training and Education Directorate funding will meet the recruitment, the in-country training, the in-country induction, and the mentorship costs. Clearly defined blocks of training work with subject matter experts has been identified, i.e. what we have done is map the curriculum of the UK with the curriculum of the countries we are bringing the international recruits from to see what the gap analysis is, and then given them a Lego block of training in country. This is specifically done so that we don't actually jeopardize the training in the UK, because as we all know, we have already got stretched the limits for training in some of the professions we're talking about as far as educators are concerned. And all we want to do is to make sure that the additional international recruits actually create that additional burden, which is why we have developed this Lego block of in-country training so that when they come here, they're able to hit the ground running. The timelines for the candidates to start in post will range from 4 to 6 months, dependent on the profession. So this is what I mean, Lego block of training. So basically what we're going to do is we supply to meet the CDC demand, like I said. We'll identify the training needs, then develop a training plan. Once that training plan has been developed, the candidates will be interviewed and post will be accepted. There'll be the in-country training and the induction that will happen in the country of origin. There'll be an assessment of the competencies at the end of that in-country training. Then they will be like I said, in-country induction, and they'll arrive in the UK and undertake the UK induction. So that's the plan of what we call safe recruitment. Next slide, please. So just to give you an overview, so even before the candidates are taken in to decide whether they'll be ready for interview, they'll be having what is called a long listing process in the home country and interviewed to decide whether they are actually suitable for the in-country training and therefore access to the posts. The NHS Trust will recruit from these cohorts. In-country training and induction will happen, the assessment of competencies, and following that, they'll come to the UK where there'll be an induction in the UK and the commencement of what we call the preceptorship program. This is going to be for 6 months. And in some professions, they've decided they will do a 1-week residential induction in the UK prior to starting. Then the commencement of employment, and this should be achieved by December 2023. The 6-month preceptorship I just talked about, ongoing mentorship and practice education, and more importantly, making sure that there is a career progression in each of these professions so that we then help with the retention agenda that Neris was talking about. And at the end, we hope to evaluate the program. This is just some indicated timescales, as you can see, and today's webinar is, and creating that frequently asked questions is one of the steps in that timeline. But cohort 1, we are planning to start the interview process from June onwards. So hopefully that will help with the radiologists, radiographers, and the echocardiographers, like I mentioned. And then, of course, cohort 2 will actually start in September onwards. Next slide, please. So this is just to give you the governance structure of the diagnostic programs, because more recently this has changed. And what we now have is the Cancer and Diagnostic Workforce Board, which will actually have the report, which reports to the National Diagnostic Board. And this program sits under the National NHS Workforce Training and Education Directorate on one side, and then you have the program resource management and the trust and CDC human resources on the other side. And below that, you have the partners who are actually helping with the supply. So the NHS Workforce Training and Education Directorate will be looking after the financial planning, the contract management, reporting, and the supporting governance arrangements. The program resource team will be working with the supply and the Human Resources Department to support the recruitment processes, as well as the pre-interview to interview and employment checks. We have got a checklist that the employers can use to make sure that all the points are taken into consideration when they're doing the pre-employment checks, etc. The two the role of the supply chain is going to be sourcing the candidates, interviewing them, dealing with the post-interview checks and supporting the candidates, providing the in-country training and support network to the international recruits while they are in employment as required. And this trust and CDC human resources are responsible for working with the program management resource to fast track these international recruit internally, so that you can ensure that the candidates are all recruited and offer letters and certificates of sponsorship, etc., are in place to help with the pace at which we need to do this, move with this program. Next slide, please. So I think I now will, with the panel, we are happy to take questions about the plans for international recruitment. And I will go to Pamela, who's actually looking after our questions. So Pamela.
We've published a couple, Geeta, but we're just getting a few through in terms of some themes. So there's one question around, will the training plans be coordinated with the input of professional bodies?
Yeah, so shall I answer that?
Please.
Yeah, so yes, definitely. So each profession, we have actually been working with the professional bodies. So for radiographers, we are working with the Society of Radiographers. For the echocardiographers, we work with the School of Healthcare Science and the pillar leads as well. So as you know, we've got diagnostic pillar leads for each of the professions, and we're working with them and therefore getting the expertise in help mapping the curriculum like I talked about. There is any?
Yeah, can I ask a follow-up question?
Yeah.
So this one is in reference to radiography. So this would be a good example. So has the mapping for radiography been completed and the building block designed?
Yeah, so the mapping for radiography was kindly completed by the Society of Radiographers, and the building block has just been, they're just finishing modeling the building block for that bit of training. Okay, any further questions? It says publish. Will the slides be shared afterwards? Yes, the slides will be shared afterwards. Can you share the workforce modeling? I'm going to hand over to Simone and Neris. Can you share the workforce modeling, it says? So is that the workforce modeling for the CDC, I presume? Yeah.
Yeah, I think they're talking to what I referenced there, Geeta, in relation to the workforce modelling that we did for the acceleration plan, just to note that it was based on the number of sites that were being accelerated rather than a complete and comprehensive workforce model for all acute trusts and CDC sites. So the workforce model was limited based on a limited number of sites. We know there's a greater need than just the 400 professionals across all sites, trusts and CDCs. So this is an element of the workforce plan, as Neris has indicated.
Yeah. Okay, thanks, Simone. Will the training plan, we've talked about where the practice education planned or allocated from. Where is the practice education being planned or allocated from? So I think that this is the practice education or the mentorship of the preceptorship program will be from the different organizations that are actually taking these international recruits.
That's correct. So I think there's an allocation of funding, just to add to that in terms of the payment process. So there's an allocation of funding per candidate for the practice educators, and then that can be done at a system level, it can be done at a trust level, and that is down to the system and trusts and region.
Thank you. Do we know where the international recruits will be posted? Yes, so like Simone mentioned, when the demand was scoped, we had gone to the different host organizations and CDCs to ask for which organization would like to take international recruits. So I think they'll be posted there, isn't it, Simone?
That's correct. This is about addressing the gaps with the CDCs. We know that a number of CDCs have rotational workforce, so we understand and would advocate for a rotational workforce in any event through the CDCs, based on the feedback we've had from staff that this is a great experience. So yes, they will be recruited by the lead organisation for that CDC, and then they will be it will be expected that that addresses the gaps. Just to let you know that one of the benefits that we will be expecting to realise and will be monitored against is around that reduction of agency cost in 24-25 allocation of CDC funding. So that will be a key aim.
Yeah. Just for clarity, the candidates will be interviewed by the CDC or affiliated trust. Yes, absolutely, Jennifer. They will be interviewed by the CDC or the affiliated trust. Yes, you've already jumped to the last slide. So what are the next steps after today? I can let you know in a minute once we finish with the questions. Will the learning from the coordination and creation of the training plans be made available for regions and trusts to inform future and additional international recruitment, recognizing that this is an area that we could really improve on? So Jessica, we can take that question outside of this meeting. Yes, it would be useful to share some of this training plans. Yes, absolutely.
There's a question in here, Geeta, around where does responsibility sit for pre-employment checks, etc., booking of flights and support to candidates. You okay to answer that one?
Yeah, so sorry, I can't see which one. Can you read the question out for me, please?
Yes, yeah. Could you please clarify who is responsible for pre-employment checks, booking of flights, support to candidates to apply for visa?
It will be the host trust for the CDC that will be responsible for applying for the visas, and the relocation costs that Simone talked about that is given to the trust will pay for their flights and accommodation as well. So I think that would be the responsibility of the employing organization. I hope that answers that. How many candidates will be assigned to trust? Is there an opportunity for trust to have a say on the selection of the candidates? Yes, as we just mentioned before, the interviews will be conducted by the trust, so they will definitely be deciding who to appoint. Did you mention a 6-month preceptorship? How will this be managed? Yes, we did mention a 6-month preceptorship program. This will be like we have taken similarities from the nurses preceptorship program, and we felt that it was important to actually give them the 6 months. So they will be actually supernumerary funding for the 6 months, as well as support for these candidates so that they can move forward in their career once they, come and get settled in. Can you explain the expectation of having dedicated HR support within the trust? The guidance suggested the trust need to recruit to dedicated posts. Simone, did you want to answer that one? Or
so the HR support.
Yeah.
So the HR support is given to enable and again support the resources to recruit into. So there are various options in relation to how that's operated. That can either be done at a system level across the CDCs and trusts, or you could do it as the trust lead. How you appoint is down to the system and trusts that are involved in the recruitment.
Yeah, I think the reason why we decided we needed to give the trust more HR support was that some of the time the reason why we lost candidates is because they actually weren't given the offer letter or the certificate of sponsorship in time. So the idea of the additional HR support is to support trust to help with that. Our imaging network has submitted expressions of interest, but waiting further communication from the national team in relation to queries raised about formal sign-off can be taken forward. Sorry, I didn't understand the question. Nerisol Simon, imaging network has submitted expressions of interest, but awaiting further communication from the national team in relation to queries raised before formal sign-off can be taken forward.
Yes, so we will, so I haven't quite understood the question either. So just to, we are going to submit, based on the intentions and the requests for International Recruit, we will come back with what we nationally can support. And then once we've done that, we will be asking for a number of next steps, which Geeta will get onto at the end of the webinar, but in essence there will be a commitment to those particular posts. I hope that answers the question and that I've understood it. If not, please do repost with what your intention was.
Thanks, Simone.
Geeta, there's
yeah,
a kind of a question, but kind of a point as well, which I think is worth raising, which says, somebody says one of our concerns is retention of staff once they arrive. Obviously this approach is really focused around supporting the recruits when they arrive. Retention is absolutely fundamental to it. So that's why the support and the preceptorship element has been included. So I think that, yeah, really important point to raise. Thank you.
Yeah, thank you. Yeah. So far, we have had delays with the visas with current international recruits in imaging. Will this be smoother going forward? Yeah, I think that's exactly the reason why we have put in all these checks and balances to make sure that the process is smoother. So as soon as the interviews are over, it's trying to make sure that the trusts have the support, HR support, to actually move forward with some of the processes. And because funding is going to be available separately to the trusts for this, that would also help. If we requested posts, when will we be notified, and how many of our trusts has been allocated? How many our trust has been allocated? So this is basically, like we said, there's going to be a cohort 1 and a cohort 2 for the program. And if you asked for the cohort 1, that is the radiologists, radiographers, and echocardiographers, then we are hoping that will be the first cohort to actually help with this. Neris, did you want to come in that we are also looking at the way in which the places are going to be filled first by the tier 1, tier 2 process?
Yeah, we're still working through. So at the moment, the demand sort of exceeds the level of supply that we would be looking at. So we're just working through what some of the numbers look like, obviously some of the queries that are coming in, and also having a look at mapping that against where we know there are particular challenges, against where the tier 1 trusts are, and where some of the particular challenges around diagnostics tests are as well. So we'd be looking to confirm that shortly afterwards.
Okay, I hope that answers your questions. Could you please, again, that we've said, is there an opportunity to review initial submissions for need of? Is there any opportunity to review initial submissions for need for international recruitment, noting we were still scoping on submission? I'm handing that to Simone. So they're saying, can they actually review the existing submissions?
I think what we need to do is come back to you with what we can support. As Neris stated, the ask is beyond what the supply can be given. So we have had to cap some areas, notably radiographers and radiologists, with a maximum of 12 radiographers and a maximum of 4 radiologists per site. So we will send out the commitment from a national perspective. We will then need you to commit from an ICB regional system and regional perspective on that to confirm that they are the numbers that you will progress.
Can we still submit recruitment requirement now the scope is wider than original? Amanda Price has asked. Scope is wider than original. I thought this was the scope we had sent. Simone?
Yeah, the scope incorporated all those various areas that Geeta stated within the presentation. So the scoping document did ask across all the professions. So we have really closed now to any submissions. We need to now commit back to supply. We can, as part of that, possibly look at whether there is anything that we can do in areas not submitted, but we need to assess whether that supply is available. I would suggest that we come back to you with the supply that we can honour, and then there is a discussion with us if there is anything that you are wanting to add in, and we will confirm whether that can or cannot be done. And it will be dependent, because there is that cap on radiographers and radiologists that we are just noting, so it depends on the areas you're asking for. And I think a discussion with yourselves as Systems Trust at that point will enable us to validate and respond to that on an individual basis.
Thanks, Simone. I think the next question is also for you. Is this scheme only for NHS organisation CDC service delivery and not for CDCs which are delivered by ISPs?
That's correct. This is only for NHS. This is not for supplying ISPs. This is NHS services only.
Is the funding for HR support and admin support available to individual organizations, or is it meant to provide central support for each ICS? I think it's host organizations, isn't it?
Yeah, so the amount, so we've given one whole time equivalent for each for 6 months. So the amount is per system for the HR and admin. Whether that is split up per trust site is again down to the system and how it's allocated.
You. Just to reconfirm, will the trust be liable for all relocation, training, flights, temporary accommodation costs, any other examination, BTA extra fees, any other examination BTA extra fees? So yes, the trust will be liable for relocation, training, relocation costs, not the training. It's just relocation, flights, temporary accommodation. I think the money actually, Simone, do you want to just explain?
Yeah, so we're covering, so as part of when we come back and we report back on what's been supported, we will also include the funding and what's supported in that funding. So there's accommodation, there are flights, visas, all the relocation costs will be provided. So the trusts are not expected to pick up that bill. It will be covered by what is allocated to those sites.
And it also includes the 6 months of supernumerary funding, isn't it?
It does for the candidate, for the international candidate. Yes, it does.
And all the training elements, etc., are all part of what the Workforce Training and Education Directorate will be funding. Will recruits be required to stay and work in the UK for a specific length of time? Nerys, are you answering that question? Why don't you say?
Yeah, I was just going to answer that one. So yes, we also want to support, obviously, attractiveness of these roles. So this is really important for us. So if the funding from the CDC programme is available through to March 25, that's the minimum contract that we want to be stating. But actually, in order to make these more attractive and to make it more sustainable, we'd really like to be working with individual trusts and CDCs to see where possible, if there is agreement, that these could be offered as permanent. So as a minimum through to March 25, but where possible, we'd like to be offering them as permanent. And then the following question there is also around, are the staff for CDC only, or can they be rotational within the trust? So I think our understanding, sort of expectation actually would be they would be rotational within the trust and the CDC. Again, the attractiveness of that and the support is the preferred model. So that would be our understanding. Obviously, we'd be happy to work with individual CDCs if they're looking at a slightly different model, but that would be our understanding.
Yeah. Thanks, Nerys. What is the role of NHSE in regions as a part of this, please? Nerys, did you want to answer that one?
Yeah, so we're hoping that NHS England in regions, obviously supporting this process both from a workforce perspective and also CDC. It will depend on the different models within regions as to how that actually happens. So we're trying at the moment for communications around this to go through both CDC and workforce leads. If we are missing people out, then that's not intentional. But please do flag if you have a slightly different model. Once we've confirmed back what where the place or the recruits are going to be going, we'll work on a much more closer basis with the trust or CDC in that area to support the sort of the detail around the programme.
Thanks, Neris. So next question. Our expression of interest was based at a point in time. We have since recruited to some posts. Can we reduce our need? Definitely, you can reduce your need. So if you actually can let Simon know so that we can then actually use those posts for the trust, right, Simon?
Sorry, Geeta, say that again.
So they've asked that our expression of interest was based on at a point in time. We have since recruited to some posts. So can we reduce our need? I've said yes, isn't it?
Yes.
They can. Yeah,
absolutely. Yes, of course. If you don't need that amount, what we don't want to do is have a number of recruitees coming in without posts to go to. So I think having a realistic number that you can recruit into is really important.
Thank you. Will the CDCs be able to support ongoing practice-based learning of healthcare students training in the UK? So this is not actually related to this webinar, so I think that can be taken outside of this meeting. In terms of timelines, I presume that recruitment of cohort 2 needs to start only in September. That is correct. Will recruitment only be for specific centres where the skills and competencies align with UK regulator requirements? Simon?
The skills and competencies, yes, will be in line with the regulatory requirements for the professional and in line with professional bodies and HCPC, etc. So the cohort, I think radiographers and radiologists, there's already a piece of work that's been done on that. And Geeta and Neris can probably say more on that. And same with echocardiographers, and there's work on the others as well. Neris or Geeta, do you have anything you wanted to add on that?
Yeah, nothing except that, you know, just to say that we wouldn't be putting them into places where they don't fit the UK regulator requirements. For example, I know that there was a question before, sonography is not something we're recruiting to at the moment because it's not a regulated profession. So we don't want to be bringing international recruits into that space. Will there be separate practice education monies? That we've already explained. Yes, there will be. Does this CDC recruitment come under the CCS framework? Simon?
The CCS framework.
Yeah.
Does the CDC recruitment come under the CCS framework? I would have to seek advice on that. I actually don't know the answer. So we'll note that question down and come back on that, if that's okay.
Yeah. We will not require the majority of permanent staff till later 24-25 used managed equipment service for most CT and MRI for our interim CDC. Means not requires staff till after December 23 timeline you have set out when need to be imposed. Will there be a later international recruitment process? There won't be a later recruitment process. So the current commission from the Secretary of State is actually for recruitment to complete in December 23. Am I right, Simone and Neris?
Yeah, the funding's for 23 to 24. So it would need to complete within the 23-24 revenue period. We are looking at what we can do for 24-25, but that is not confirmed yet. So what we're looking at is 23-24 funding at this point.
Who will be responsible for the support of host trusts, in particular, ensuring all the paperwork and checks are completed within given time frames? Is that a national team role, or will it be devolved to regions? How do we maintain a consistent approach across all regions and make sure we support everyone through the process? Neris, did you want to come in about what support we will be giving regions?
So we will be having a national function that will support the recruitment. So as I said, that can support that facilitation and making sure that things are happening in a timely fashion. There is a clear checklist that sets out the different roles and responsibilities and requirements as part of the process. So that will be the trust responsibility to do that. The additional funding that Simone has already mentioned around the HR and admin support, the purpose of that is to support the timely, efficient and effective HR and admin around the programme. So with the funding, with that central national support as well, that's how that would work.
Thank you. Please can you share the Q&A after the webinar in a typed format so that this can be shared easily with our systems? Yes, that's the idea. So we are going to add additional questions, etc., which we've not been able to answer today. All will be into an FAQ format for systems. Will there be a minimum return of service clause in the contracts? I don't know what that means, sorry.
I think I know what that means, Geeta. So this is around saying that if the international recruit will be asked within contract to stay with the organisation for a period of time, say 2 years post recruitment, you can absolutely build that in. That is something that has been put in, especially where training is being supported in the past. So that is an option that is available to you. We are not stipulating that, but that is something that you can put in place should you wish.
Yeah, and like Neris said, I mean, we wouldn't mind having a permanent contract if that's what you would like. If there is a 6-month supernumerary period, can they contribute to service earlier if the competencies are signed off? Yes, absolutely they can. The 6 months was just to make sure that there was a safety net. Will the radiologist be recruited under the existing 3-year earned return scheme, or is this now stopping and being replaced by this? I don't think that we are stopping that at all. This is in parallel to this. So this is for the CDCs, and the other one is for organizations that still want to recruit radiologists. We're not supporting that. We're not stopping that scheme. For CDCs that are based in regional areas and not in cities, will you also lean on expertise from the private sector on increasing staff retention and reducing churn? Mon?
Yeah, I think we're not, I guess the focus for us is international recruits and getting those into the NHS trusts as quickly as possible, and the CDCs as quickly as possible. So in relation to leaning on expertise from the private sector, I guess I would need to understand and clarify what expertise in particular we would need to be leaning on there, noting that what we will be recruiting to is the specific locations that you have specified within your request. And that is what the international candidate will be informed about. That will be where they're employed into. We know that there is churn between private and public, and that's something that does occur on a regular basis. I think that staff experience aspect is a key piece, and some of that is around equal opportunities for progressing within their radiographic career, for example, or as an echocardiographer, and some of that wellbeing support that I know many trusts and systems provide. So I think that's how we're trying to, but I don't know, Neris, whether there's anything else you want to add on the retention piece of that, because I think it plays to that specific topic.
Yeah, nothing further to add at the moment, Simone, thank you.
Okay, and the last question, do any CDCs plan to have histopathologists working for them? So yes, we have had some requests for histopathologists in the scoping requirements. Okay, right, I think, Val, everybody was keen to get the next steps, isn't it? So next steps. For the national team, it is to start to confirm the demand, supply and allocations to the CDCs and trusts for cohort 1. So this is basically what we need is a business case signed off by department, director of finance and HR, to confirm funding processes to CDCs and trusts, and to begin to establish one-to-one connections with the CDC. So that's what the next steps are for the national team. For the NHS Trust and the CDCs, it is to confirm in writing to NHSE that the Trust and CDC has funding signed off by both the Director of Human Resources and the Director of Finance. If applicable, to confirm in writing the level of expertise required, say, for example, for radiologists, do you need them at specialty level or as a specialist? The difference being that specialists are people who have actually done their fellowship exams as well as having worked in their home country, and specialty will be people who have done their radiology training and taken a postgraduate degree in their home country but have not taken the fellowship exams in the UK. To provide assurance that ongoing pastoral care and mentorship for the international recruit has been mobilized, and to commence next steps on international recruitment checklist and process for setting up the interview panels, etc. So those are the next steps. And like I said, we'll be sharing the slides. We will be making sure that there is an FAQ that's developed based on today's discussions. And if you have any queries, that's the email to email. And thank you very much for joining us today. And I hope this has been useful to all of you. My thanks to my panel, Neris and Simone, but also a big thank you to Val and Pamela, who have been working behind the scenes to make this webinar a success. So thank you very much, everybody.